Welcome to the video answers for another Part 1 question set. Let's get started. First question says, what's the difference between mean, median, and mode? And we're going to get to the second part of the question in a moment, but let's talk about these definitions first. Mean is what you usually call the average. You add up all the values and then divide by the total number of values. Median is the middle value, taking into consideration the frequency of distribution, so that half the values are above the median and half are below the median. And then the mode is the most frequent value, the value that turns up most frequently. Then the second part asks, what are the relationships between mean, median, and mode in a positively skewed curve and a negatively skewed curve? So in a perfect Gaussian bell-shaped curve, mean, median, and mode are all the same. Mean equals median equals mode. In a positively skewed curve, the curve is shifted to the left with a tail to the right, so that the mean is greater than the median and the median is greater than the mode. And then a negatively skewed curve is just the opposite, with the curve skewed to the right and the tail to the left. So the mode is greater than the median and the median is greater than the mean. Next, what foods, typically high in mercury, should be avoided during pregnancy? Well, the short answer is fish, but certain types of fish are particularly high in mercury. These tend to be fish that eat other fish because they're consuming all the mercury in those smaller fish. So the FDA has recommended that pregnant women specifically avoid eating shark, swordfish, king mackerel, and tilefish. And as an aside, what's the problem with mercury during pregnancy? What problems does it cause? Brain damage. Next, when an infant is born and takes its first breath, the lungs expand and create negative pressure that draws blood into the pulmonary circulation. Because the pressure in the pulmonary circulation is lower than that in the aorta, blood preferentially flows into the pulmonary circulation and the ductus arteriosus closes. What other fetal blood vessels are closed in the adult circulation? So you have the umbilical vein, which becomes the ligamentum teres hepatis, which is contained within the falciform ligament. The umbilical arteries, which become the medial umbilical ligament. The ductus arteriosus, which becomes the ligamentum arteriosum. The ductus venosus, which becomes the ligamentum venosum. And the foraminal valley, which becomes the fossa ovalis, which is typically closed. Next, you're rotating with an anesthesiologist and learning to calculate dosages of anesthetics with her. How does the rate of elimination differ between zero-order elimination and first-order elimination? So zero-order elimination is where you have a constant amount of drug eliminated per unit time. For example, the patient might metabolize a constant 5 milligrams of drug every hour, hour after hour after hour. So if you were to graph the plasma drug concentration versus time, the graph would be linear in zero-order elimination. Then a first-order elimination graph is a curved graph instead of a linear graph. Instead of a constant amount of the drug being metabolized every hour, a constant fraction of the drug is metabolized. So every hour you might metabolize 10% of the drug or 25% or whatever fraction it is for that specific drug. And then which type of elimination behaves as though the enzymes responsible for elimination are saturated? Well, that's zero-order elimination. The amount metabolized stays constant regardless of the plasma concentration. Next, what artery supplies the distal third of the colon and what artery supplies the proximal two-thirds of the colon? So students are seeing a lot of anatomy on step 1 in Comlex level 1, especially vascular anatomy and especially abdominal vascular anatomy. So the distal third of the colon is supplied by the inferior mesenteric artery and the proximal two-thirds is supplied by the superior mesenteric artery. And then from what embryonic structures are the distal third and proximal two-thirds of the colon derived? Well, the distal third is derived from the hindgut. The proximal two-thirds comes from the midgut. Next, what's the mechanism of action and clinical use for varenicline? Varenicline is a partial agonist at nicotinic acetylcholine receptors, so it stimulates nicotine receptors more weakly than nicotine does. So it's used for smoking cessation under the brand name Chantix. It's also worth knowing that this agent currently has a black box warning for neuropsychiatric events, including depression and suicidal ideation. Next, what anticonvulsants are used to treat absence seizures? So absence seizures are brief seizures where the patient sort of has a blank stare, but there's no postictal state. They sort of seem to just zone out and stare off into space and they come back to it. These are treated with ethosuximide first line or possibly valproic acid, but definitely remember ethosuximide as the first line treatment for absence seizures. Now, what anticonvulsants are used to treat status epilepticus? Well, there are two things you need to do for status epilepticus. First, you need to break the seizure so they're not going to get hyperthermic or get any rhabdomyolysis or something like that. So for acute treatment, to stop the seizure, you give benzodiazepines like lorazepam or diazepam. Then, once the seizure has stopped, you want to treat with an anticonvulsant to prevent further seizures and prevent the patient from going back into status epilepticus. So for prophylaxis, you're going to use phenytoin first line. So it's benzodiazepine for acute status and then phenytoin for prophylaxis. Next, what asthma medication fits each of the following statements? The inhaled treatment of choice for chronic asthma is an inhaled corticosteroid like fluticasone or budesonide. Inhaled treatment of choice for acute exacerbations would be a short-acting beta-2 agonist like albuterol or levoalbuterol. The drug with very narrow therapeutic index, which makes it a drug of last resort, is theophylline. Blocks conversion of arachidonic acid to leukotrienes is xyluton. Inhibits mast cell release of mediators, used only for prophylaxis, is cromolyn. Inhaled treatment that blocks muscarinic receptors, these are ipratropium and tiotropium. You can use the trope in the names ipratropium and tiotropium to remind you that these are muscarinic antagonists, just like atropine. Inhaled long-acting beta-2 agonist is salmeterol. You can think about salmon having to swim upstream to spawn, and that takes a really long time. So salmeterol is the long-acting beta-2 agonist, unlike albuterol and levoalbuterol, which are short-acting. And then the drugs that block leukotriene receptors are montelukast and zofurlukast. Next, which diuretics are most appropriate for patients with hyperaldosteronism, and what are their important side effects? So the most appropriate diuretics are the aldosterone antagonists, spironolactone and eplerenone. These block the effects of excess aldosterone. And then the side effects include hyperkalemia, because they're potassium-sparing diuretics, so they cause a little potassium retention. And then spironolactone is also an antagonist at androgen receptors, so it can lead to some gynecomastia in men, and it also has progesterone agonist activity, and that can cause some menstrual irregularities in women. Next, what's the mechanism of action of neomycin? Neomycin is an aminoglycoside antibiotic, and aminoglycosides prevent bacteria from synthesizing proteins, specifically by binding to the 30S subunit of the bacteria's ribosomes, and that inhibits formation of the initiation complex, so they can't produce proteins. And then what are the toxicities of this class of medications? Well, aminoglycosides are well known to be nephrotoxic, ototoxic, and teratogenic. So they can damage the kidneys, they can damage the vestibular cochlear apparatus, and they can cause birth defects, specifically fetal hearing loss. All right, that's the end of this question set. I'll see you next time.